Good afternoon, everybody. Myself is Dr. Ajay Kaushik. I'm the consultant physician working as a general physician at the Secretary to Vatika Arogyam Multispecialty Clinic. So today my topic is how to take care of heart in diabetes. In today's session, we will discuss what the diabetes complication impact on the heart as a preventive measure for people with diabetes to prevent the heart disease. At present, heart disease remains the leading cause of hospitalization and death. Although most people have heard of heart disease, few understanding exactly what it involves and in turn may not taking proper steps to reduce their risk of heart disease. Heart disease occurs when blood circulating to heart is slowed or stopped because of a blocked artery. So what can be the reason behind the blocking? One of the major risks is the high sugar level known as a diabetes. Let us know how the diabetes exactly mean. Diabetes is a lifelong disease that affects the body's ability to control the blood sugar level. In a simple word, it is a condition which the body has too much glucose in the blood. Let's understand why does it happen. Usually when you eat food, the glucose enters in the bloodstream. Further, the insulin, which is a hormone, break down glucose from the blood into your cell to be stored or used for the energy. With the diabetes, your body either does not make enough insulin or can't effectively use the insulin to break the glucose. This leads to high sugar level in blood or diabetes. Did you know diabetes can increase your chance of dying from heart disease? Yeah, it's true. With diabetes, you are more likely to have a heart attack. So when it comes to diabetes, prevention is very important, and as it can affect your whole body, from your eyes to your feet, especially your heart. In fact, people with diabetes are twice as likely to heart attack or a stroke as compared to without diabetes. And it's reported that among people diabetic or more than 65, approximately 80% die from heart disease. The chance of developing heart disease among people with diabetes is not dependent on how well you manage your glucose levels. So when we think about diabetes, we should really be thinking about the heart disease as well. Moving on, let us how high blood sugar level leads to heart disease. High blood glucose can damage the blood vessel, worsen the cholesterol level, and make the blood pressure more difficult to manage. Persistent high blood glucose lead to diabetes, make the blood vessel prone to atheroma. The condition is a narrowing of blood vessel due to collection of bad cholesterol. When the blood vessels narrow, the blood flow has a trouble reaching different organ in your body, include the heart. A sudden stoppage of blood flow to the heart may lead to heart attack. There are a number of things you can do to lower your risk of heart disease. Understanding the connection between diabetes and heart disease is the first step toward the prevention. Diabetes is a common referred to as lifestyle disease. Managing the diabetes requires the patient to make a different, significant, and the lifelong change in their lifestyle. These changes require the lifelong commitment from the patient. One can control the blood sugar level to lower the risk of heart disease by changing the lifestyle. So let us know each the preventive strategy in the details. First of all, know your diabetes ABC. A is the HbA1c level. Is a blood test that measures the average blood sugar level out of the past 3 months. The average goal for many patients with diabetes will be below 7. It may be different for you. Ask about your what goal should be. BP, B for blood pressure. So if your blood pressure is too high, it makes your heart work too hard. The blood pressure goal must be in a diabetes below the 140 to 80 millimeter of mercury. C is the cholesterol. There are two kinds of cholesterol, LDL and the HDL. LDL is a bad cholesterol and HDL is a good cholesterol. So your goal may be different from other people. If you are more than 40 years, you may need to take statin. Second is eat healthy and a well-balanced diet. There is no one size fit all approach to eating healthier, but important to have a regular meal pattern. Your fat and the carbohydrate intake are crucial to managing both diabetes and heart disease. Make simple switches from saturated to unsaturated fat. Too much saturated fat can increase the high blood cholesterol level, so it is important to reduce the amount you eat and instead get the fats from unsaturated sources. See the butter and ghee from unsaturated vegetables and spreads such as sunflower, olive, rapeseed, or corn. Remember, fatty food are high in calories and excess energy result in high weight gain. To help you manage your weight, it's important to keep an eye on total amount of fats you are consuming. So diet high in saturated fatty fats are linked to high LDL in the blood. Eating unsaturated fat instead of saturated help to maintain the healthy cholesterol level. Eating right. Avoid refined wheat, bread and cereals, potato chips, red meats and processed meats, saturated fat and sugar, sweetened beverages. Eat foods with more fiber such as grains, cereals, dairy foods, beans and legumes, fruits, nuts, healthy oils such as olive oil. Cut down on salt. Too much salt is linked with a high BP, which is a major risk factor for the heart disease. So Remove the salt shaker from the table to stop your adding extra salt. Try to adding the flavor to your food using the herbs, spices, black pepper, and the lemon juice. Here are some tips regarding diabetes. Should continue the eat balanced diet, eat a reasonable amount of calories, and eat regularly at time and slowly. Try to maintain a healthy weight and engage in regular exercise. Weight loss is very important to improve the cholesterol level and triglyceride and BP and diabetes. Start with slow intensity, short duration workout, gradually increasing intensity and time. So medical management of for diabetes, take your medication as prescribed by the doctor. Eat meals and take medication regularly at right time, and also remember the low risk of hypoglycemia. So quit smoking and stopping harmful use of alcohol. Unfortunately, many people with diabetes smoke. So smoking increases the risk of diabetes and increase the insulin need and increase the risk of hypoglycemia. To stop the smoking is considered as part of diabetic care. Cope with stress is a best care. Stress is known to raise the blood sugar. Instead, try medication, deep breathing, and other relaxation technique to beat the stress in a healthy way. The bottom line is diabetes can lead to serious medical complications, including heart disease, but you can manage the condition with medication, the lifestyle changes. Avoid the most common diabetes complication with preventive tips. Thank you so much. So by this slide, I have briefly is regarding the how to take care about your heart in a diabetic patient by doing exercise, by taking the low saturated fats, low salts, and proper diet and exercise with proper medications.